Okay, for today's case, I wanted to talk briefly about this particular ClinCheck. So you can see this patient obviously has a few things going on. They've been to a dentist quite a bit in the past for some crown work and some filling work. There's some spacing that looks like it needs a little bit of attention. Ideally, there'd be a discussion about potentially closing that space, gauging the patient's interest. There's some crown work here. We've got a lot of recession and some abfraction. So you can see several abfractions have been repaired already at least once. So lots to discuss with the patient. So when I would review this case with the patient sitting down, of course, I do an intraoral exam, look at any x-rays, talk about appropriate treatment and course of action items. But there are a couple of things that stood out to me, and I'll walk through those with you. Sometimes we get a little bit of stain, as you can see here on the lower right. One of the strengths of this new iTero with the NIRI, the infrared, is it can really help us to identify potential areas of tooth decay. So as I hover the magnifying glass or the little spot identifier over this area, I'm not seeing any white spots. So honestly, this tooth isn't something that really concerns me. Yes, there's some darker areas, but oftentimes that's corrosion or byproducts that are associated with the bonding process and stuff like that eventually changes color. I'm not seeing any white spots. Yes, there's a little chip out of that filling, but all things considered, this isn't something that I would recommend treatment for. I would discuss it with the patient and make mention that we may need to talk about this in the future, but for now, it's not something that worries me. Now over here, on the other hand, we've got some fairly significant fracturing developing on the mesial surface of number 20. Now let me clarify, I think I talked about this in the past. A crack where the surfaces are still approximated and there's no decay isn't necessarily going to be something I'm going to recommend treatment for. So let me say that again. A crack isn't necessarily something I'm going to recommend treatment for. A fracture, and to me a fracture is something where there's actually separation, is something that I'm always going to recommend treatment for. Now, oftentimes I'm still recommending treatment for just cracks or craze lines. I essentially use those two interchangeably. However, a fracture where there's a separation with or without decay is something I'll always recommend treatment for. So I'd encourage you to set up your own clinical standards there and determine what works for you in what situations. So in this situation, in my opinion, we definitely have some tooth decay there. And in that spot with the crack and the separation that we're seeing, it would indicate a full coverage crown and core buildup. Depending on what we saw in the x-rays, potentially a root canal, and of course if it was symptomatic, it might require something else. So one other item that we were able to see here on the buccal of tooth number 19, I'm not sure if it's as clear as it was on the x-ray, and I don't have those x-rays to look at, but there's some decay up underneath the edge of this crown. So that kind of leads us into a further discussion, a more detailed discussion. That patient has a lot of recession. So is that toothbrush abrasion? Is that just recession? What's causing this? Is it periodontal related? In my opinion, based on the occlusal analysis, if I turn these guys off, go back over here, turn the upper arch on, turn on the bite intensity, we can see a heavy bite. So essentially this patient has a lot of pressure when they're chewing, so it's causing, in my opinion, again, this abfraction, which is causing recession. So the teeth are flexing, which causes the bone to move down, which causes the gums to move down in turn. So this is another reason to have another discussion or an ongoing discussion with the patient to consider, at least number one, mitigating the symptom, which is some sort of an occlusal guard, whether it's a hard soft or a hard or something like I like to recommend, which in most cases, when there is an absence of symptoms, TMJ symptoms or pain in the teeth, usually I recommend Invisalign Vivera or Invisalign retainers as a night guard, because the plastic is very durable. It's high quality plastic. You can use it as bleaching trays. I love the stuff. So managing the symptom or managing the cause. There are a lot of multifactorial connections with the causes, so it's something to get into the medical history. Sometimes medications causes clenching and grinding, could certainly be related to stress level and other things, but oftentimes it's related to an inconsistent or unstable bite. And so again, it's another reason to discuss realigning or restraightening the teeth. Now, as we've identified, we've got some spacing here, which could be corrected or fixed with something like Invisalign or conventional fixed brackets and wires. So if I turn off that bite intensity, Everything else, in my opinion, looks pretty good. Some fillings that seem to be doing okay. There are a couple of cracks or craze lines, as I mentioned, but nothing that warrants treatment except for this guy down here because there's actual separation and there's decay developing. We had also, just as an aside, treatment planned a crown and a root canal in this tooth. I'm assuming there's an abscess there, periapical involvement, or an extensive cavity. Again, I'm not pulling up the x-rays on this video, but that's what I treatment plan on this case. So I've kind of changed my treatment planning. Thank you. Over the past couple of years with regard to what I treatment plan and when it comes down to replacing fillings and going to crowns. And the reason for that is I've seen in my clinical experience over the last 15 years or so that fillings, and this again is my personal experience, not just my experience as a doctor, fillings in the absence of a fracture and decay will oftentimes be stable much longer than we originally thought they were. So I'm only really treatment planning crowns when a filling is having an issue, when there's a crack that has separation, a fracture, in the presence of decay, or both, one or the other I should say, or both. A fracture with decay, or large decay, or the need for a root canal, or sometimes for cosmetic reasons. I used to, if there was any type of a crack, with or without a separation or decay, I would be treatment planning a crown. And I think I don't regret those decisions, but I think now it's not quite as urgent in many situations. Still, the outcomes are the same. The potential risks, I should say, are the same. If left untreated, an actual broken tooth or symptoms, pain, an infection, or some combination of both. So, fun case to review for you. We talked a little bit about Invisalign with this patient and also prescribed a crown and a core buildup here, crown core buildup and a root canal in this tooth. And that's what I've got for you for this case. Thanks. Bye.